Thank you and good morning, everyone. I begin by acknowledging the traditional owners of the land and pay my respects to their elders past and present. I'm sorry I can't be with you today to welcome you all to the DHSV Public Oral Health Innovations Conference. Can I thank you all for taking time out of your busy schedule to come along to work with your colleagues so that we can all join together and more effectively support Victorians to improve their oral health. We know that people with good oral health can eat and socialise without pain, discomfort or embarrassment. Promoting good oral health has social as well as health benefits, and there has been significant improvements over the last 20 to 30 years. But there's still evidence of poor oral health among many Victorians. Communities that are predominantly affected by poor oral health include people on low incomes, dependent older people, some Aboriginal people, people in rural areas, those with a disability, and people from culturally and linguistically diverse backgrounds. We know that oral disease is among the most prevalent diseases in our community, and it's one of the costliest health conditions to treat, and yet it's one of the most preventable. Today's conference provides another fantastic opportunity for all of you to get together and share your collective experiences and knowledge, to learn how we can collaborate and develop initiatives in our local communities. It's important that people have access to the highest quality public dental programs, particularly for those who need it most, no matter where they live. Our government understands the importance of oral health to overall general health. That's why we've invested over $226 million in public dental services this year. That's about a 9.7% increase from the last year. We want Victorians to access high quality care sooner and safely. As oral health professionals, you're all dedicated to providing quality care to more eligible Victorians. With your efforts, we've seen significant improvements to the oral health of vulnerable children, teenagers, adults and the elderly. As well as your clinical programs, I'd like to acknowledge the community prevention programs that you're running as well. I know that there's still so much more work to be done. For example, dental conditions are the single largest cause of preventable hospital admissions for Victorian children under the age of 10. You'd already be aware that we're working on a new plan to prevent oral disease and reduce the gap in oral health outcomes for people that are at higher risk of oral disease. So congratulations for coming together. I hope you have the chance to make some fulfilling professional relationships today and that you walk away inspired about the things you might be able to implement back in your own communities. Most importantly, take the benefit of some time away from work to think, to plan and to feel optimistic about building a future together that will improve the oral health of all Victorians. That's something worth spending time on. So have a terrific day.